Hello, welcome to Skin World with Vincent. Today we are going to discuss something about mycosis. When we say mycosis basically refers to fungi infections. Fungi pathogens do not cause widespread or dangerous epidemic like that of bacteria or viral. However, they are responsible for the cause of individual distress, disfigurement, and sometimes causes severe life-threatening condition in people. Fungi infections is among the 4 common causes of human diseases worldwide. And as at now, there hasn't been any vaccine for fungi infections. Fungi infections or mycosis can be grouped into 3 main forms according to the site of the body that is being affected. You have the superficial mycosis or the cutaneous mycosis. Then we have the subcutaneous mycosis. Then the last of it all, which is the systemic mycosis. However, there is a 4th group which is being referred to as the opportunistic mycosis, and this opportunistic mycosis mostly occurs in people with HIV, AIDS, or diseases that are causing immunosuppression. So with this our discussion, what is the first part of fungi infection or first part of mycosis, we are going to focus on the superficial mycosis or the cutaneous mycosis. Superficial fungi infections are sometimes referred to as dermatophytosis, which is caused by a group of fungi being referred to as the dermatophytes or the tinnies. These infections mostly affect the skin, the hair, and the nails. Dermatophytosis or ringworm infections or the tinnies are mostly named according to the locations in which the infections are being found. So, assuming if it is found on the scalp, it is being referred to as tinea capitis. And when it is being found on the body surfaces, refers to it as tinea corporis. And when they are being found in the guan, it is referred to as tinea crus. And when we find them on the nails, we refer to them as onychomycosis. And when they are being found on the feet, we refer to it as tinea pedis. We are going to take each of these conditions one by one and go into details and look at how they present clinically and how you can differentiate them from other skin infections and how we are going to manage these skin conditions. First of all, we are going to start with tinea capitis or tinea infections of the scalp. Tinea capitis is mostly common in pre-adolescent children, or basically they are common in children. The clinical signs or the clinical features are highly variable. You can see one, diffuse scaling, so the head begins to peel, or they have these gray patches, dark dots in the head. You may have multiple or single pustules. You have patches of alopecia. And alopecia basically means loss of hair. We also have extensive alopecia with inflammation keloids. So keloids is an inflamed bulky pustular lesions on the scalp that occurs when there is a brisk inflammation response, and this mostly settles or heals when you give systemic antifungal. Before these keloids may be formed, fungi grows in the hair follicles, and the severe forms may form pustules with follicular pustules and nodules, and offensive, massive, purulent secretions. So when it reaches these severe forms, and if you don't take care, it may confuse you, or you won't be able to differentiate between this form of tinea capitis and that of scalp seborrheic dermatitis. Sometimes when it reaches this purulent phase, they may be inflamed anterior and posterior lymph nodes, or sometimes the lymph nodes in the neck may be swelling, and patients may sometimes complain of fever and headache, which are all classical signs when this tinea reaches the severe form. They may sometimes be bacterial superinfections of which you're supposed to take good care of. When it comes to the management of fungi infections, or mostly with the tinea capitis, systemic azoles are mostly required, and you may give antihistamines if there is itchiness. Mostly the topicals are effective, but sometimes they cannot penetrate the hair follicles to remove or to fight against this fungi in the hair follicle. So mostly it is better you treat with the systemic antifungis. So with the management, mostly the azoles are what we use in the treatment. Azoles such as the fluconazole, ketoconazole, itraconazoles, like the azole groups are what we use in treatment. But bear in mind that we have different azoles for different conditions. We have what we use to treat the yeast infections and that of the moles infections. The yeast and the moles are all under the fungi groups of infections. So you know which one to use at the right time. Sometimes you may give antibiotics in addition because of the super infections by these bacteria. You can also add topical antifungis to treat these infections. So this brings us to the end of tinea capitis. So let's look at tinea corporis. Tinea corporis, which is fungal infections of the skin, is mostly common on the exposed surfaces of the body, such as the face, the arm, the shoulder, the trunks. Tinea or ringworm presents in a typical round lesions, which shows scaling at the peripheries. So with the lesions, the round lesions that you see, the periphery, which is the ending part of the round lesions or the circle lesion that you are seeing, they may be scaling around. So this is what you use to see that this is a tinea corporis. Mostly tinea corporis may also be sometimes difficult to differentiate between them and that of the psoriasis of the skin, because psoriasis also comes with massive scaling of the body, and with that one the scaling is severe and you may see some shiny appearance too of the lesions. So whenever you see this round lesions, check for this. Is there scaling at the peripheries? Is it shiny? If it is shiny, then you should start thinking of psoriasis. And with psoriasis too, mostly the scaling is massive. You may have multiple lesions with massive scaling at the same time, shiny surfaces. But with that of the ringworm, mostly the lesions are round with scaling at the peripheries. Let's add that of tinea curis to it. So this mostly occurs in the groin. It occurs in the groin and may sometimes be erythematous, which is it may sometimes be reddened. Mostly they are itchy in nature. So whenever someone comes to you or you start experiencing itchiness, erythematous, scaling lesions around your groin, you start thinking of tinea curis or a tinea infection. Sometimes too, other infections like dermatitis can also cause this. So note the differences between them. Mostly with that of the tinea curis, it is erythematous, dry because of the scaling effects of the tinea. Now let's look at how to manage tinea corporis and that of tinea curis. Medical treatment is what is mostly required for treatment of tinea corporis and tinea curis. But if it is chronic, then you are being tempted to add a systemic antifungi as well. So as I said, with the azoles are what we use in treatment of tinea or fungi infections. That is, most of the superficial fungi infections mostly use the azole. So you go in for your myconazole, fluconazole, clotrimazole, or the iconazole. Sometimes you can use tabernacle creams as well, but it is better you know the severity of the infections so that you know what topical cream to use. And if it is severe, you can add either ketoconazole tablets or that of itraconazole tablets in addition. Let's look at tinea pedis. Tinea pedis, or the arthritis foot, is a common disease mainly affecting adults. This is mostly acquired in 1. Swimming pools, 2. Public showering areas, as in public showers, or some industrial workers are predisposed to tinea pedis, especially those who do the laundry services or those who wear mostly rubber boots for a longer period of time. Tinea pedis, mostly the skin or the interdigital spaces become macerated and may be wet. Sometimes too, tinea pedis may not be caused by fungal infection. They can also be caused by bacteria. Tinea pedis is very itchy and can affect any part of the foot, but mostly occurs between the toes where the skin becomes macerated. Across the plantar and the dorsal aspects of the feet, there is usually dry skin rashes. The hand may similarly be affected, and here too, the condition should be differentiated from psoriasis and eczema. So when it comes to the management, topical antifungals, as we mentioned in our previous discussions, are what you mostly recommend. And when it is being super infected with bacteria, it is recommended that you add an antibiotics like erythromycin or doxycycline. Then you keep the interpharyngeal digits dry to prevent reoccurrence of the infections or to help speed the healing processes. Last of it all, let's look at tinea ongum or onychomycosis, which is fungal infections of the nails. Fungal infections of the nails is common, especially in adults. It may sometimes be chronic, which is being referred to as the pyronychia. When tinea ongum become chronic, it may sometimes affect the nail bed or the skin around the nails, which is referred to as the pyronychia. It often occurs in people who frequently wet their hands, such as domestic workers, cleaners, kitchen and laundry staff. When it comes to the management, some people believe that it does not require treatment, but systemic antifungals may be helpful. You can also use dactyline cutters when the nails are becoming brittle, and you can also use the topical creams around your fingers or around the nails to prevent reoccurrence of these fungi infections. This is part 1 of fungi infections. We'll bring you part 2, which includes the systemic and the subcutaneous fungi infections. Subscribe to the channel, follow us for more, leave your comments below, and we'll respond to you. See you in our next video.